Hello and welcome to the CDO Magazine interview series. I am Mike Kaiser with Centric Consulting, and today I have the pleasure of talking with Bhavna Mehta, Assistant Vice President at Cincinnati Children's Hospital Medical Center, which also I am seeing from the website is been ranked number one children's hospital by U.S. News and World Reports earlier this year, and is number two for NIH funding for research. So what we plan to cover today is first off a little bit about you, then some topics on leadership and strategy and change management. So first, then, can you tell me a little bit about your background and journey that led you to your current role?
Thanks, Mike. It's a pleasure to be here. I appreciate the opportunity. So I have a very, somewhat of a traditional IT background, if you will. I have my bachelor's in computer engineering, and I started my career as an application developer, working on Y2K projects back in the day, if you remember. And then really moved on into developing more of custom application architecture, moving into system integration, so data integrations, system to system interfaces. And then about 12 years ago, actually it was in 2012, when I actually moved into working for our quality improvement department. So I should have started at the beginning. I've been with Cincinnati Children's for 25 years. So my most of my journey has been with them. Backtracking a little bit again, went to work for the quality improvement department. And that is really where I saw us using data to improve outcomes, to improve experience. That was my first foray. Because before then, I had built systems that collected data. I had done interfaces that moved data, right? But really now I was seeing how data was being leveraged at the front line. And that really piqued my interest. So, I had completed my MBA by then, but then I was so intrigued by clinical informatics that I went ahead and completed my master's certificate in that as well to learn more. And then I got a chance, once I kind of developed that kind of team, I took a leadership role really in our quality improvement department, developing a business intelligence team, a data infrastructure team, and it gave me more insight into what was really needed to enable analytics. And then fast forward a couple of years, I got the opportunity to really develop our enterprise data governance program, which was a really, really cool opportunity for me because it had been done in the past, but there was a lot of skepticism. But I think for whatever reason, we had the right sponsorship. The organization was ready. Even till today, it's one of the most successful, initiatives I worked on. I'm very proud of it. So we started with 4 KPIs, starting documenting those with 4 data owners and 4 data stewards. And today we have about like 40 data stewards and 40 plus data owners. And we do a lot of work with data governance. We've gone through multiple iterations of even technology implementation. So it's been a cool journey. And then, continuing on my challenge and journey, I got the chance to actually lead our accountable care organization. So in 2020, Cincinnati Children's decided to take on and start an accountable care organization, which is really more of a value-based arrangement for Medicaid kids. And I really got the opportunity to lead that from an IT infrastructure and a technology implementation perspective, as well as working with our operational leadership to develop SOPs, develop processes to leverage the technology. And I think that is an opportunity that one gets very rarely because I hired the whole team, like it was starting over, really creating a new service for the organizations. It was a really, really cool and challenging experience. Got to implement a couple of Epic, which is our electronic medical record system modules, which I had not done before. So that was cool. And then in 2021, finally, we were doing some long-term planning. The organization was doing some long-term planning, really looking ahead to our 150th birthday. We developed a strategic plan, which we tagged with calling it Pursuing Our Potential Together. And we really had some moonshot goals as part of that. We want to be the best employer. We want to cure mental health. We want to have the healthiest kids in our community. And our senior leadership, our executive leadership really believe, really sort of understood and realized that the foundation or to really achieve all these data strategy and investing in data was going to be a key foundational investment that we need to make. And as a result of that, my current role as AVP of data analytics was created. And that's where I am today.
Very good. It's an exciting career path. I can see how it's both got breadth and depth that you were able to put together over time. Can you tell me more about your current role?
Absolutely. So as my current role, like I said, I have the absolute privilege to lead our data and analytics strategy, and which includes our data governance program, data literacy, data management, business intelligence. I have an AI and analytics team that we recently started. I've got our platforms and our database administrators, as well as our population health strategy, which is the accountable care organization. I still have that as my responsibility.
Okay, when you were talking, I thought these were things that you had jumped from one to the other. It seems like you were more collecting as you went. You're talking about one of the long-term goals is a best place to work. I guess I'm wondering, how do you build and nurture your team? How do you make it a high-performing team?
Yeah, so I think when we think about a high performing team, there are certain attributes, right? When you think of high functioning team, aligned, a shared goal, a shared vision, aligned goals, open communication, people feeling empowered and heard. And I personally put a lot of emphasis on communication because I think it's very important that one, people understand what the vision is. And I'm not talking about communication that's just done, what's one and done. It's this multifaceted, multimodal communication where you have to keep doing it, right? And in different forms and meet people where they are. Communication in terms of where we're headed and why we're headed. So it's important that the team understands the why behind what, and giving them the opportunity to share feedback. That is also part of the two-way communication. Enlisting ideas, encouraging the team to come up with ideas and to try up new things. Also, I think the other thing that's important is to understand what people's goals are and really connecting those back with the organizational priorities or projects that not only push forward our organizational priorities but also help them develop in their own careers. So I think they're kind of all facets of communication but different ways, right? You just have to kind of have a pulse. I'm also fond of structure. If I were, I like to put a structure, but transparency is an important thing, honesty, and then really leading with just sort of continuous learning is an important culture to develop, to nurture that kind of a team, I think.
So part of leadership can be the team that you have, and part of it can be the healthcare objectives and the physicians or the other people who are using your technology. What strategies do you use to communicate complex data concepts and insights to non-technical stakeholders?
Yeah, I think there are different ways we can do that, and I've done that. Whether that's I think stories do wonders. Adding context, I think it's really important for us to understand who the audience is. Who are we talking to? Are we talking to senior leaders? Are we talking to middle managers? Like business leaders? Are we talking to analysts who are day to day doing the job, but might be disconnected a little bit from or might need more detail than the other folks may need. So one of the examples I can share is during our data governance. Like I said, when I launched the data governance program, it was an interesting exercise to explain to people what data governance is, what the value of data governance is, right? And we used lots of analogies like traffic control, to talk about data quality and data lineage, and we kept hearing the phrase, data is the new oil. Yeah, but oil needs to be refined. What does that mean? Right? So I think that is important, and then adding context. So if I'm talking to a financial leader, to really explain to them what it means if the data is bad to the numbers that they see at the end of the month versus a clinical leader. So if I'm using data to really do some clinical interventions, and we want all kids who are diabetic, for example, and if my data is not correct and I miss one child, it's one child who may not get the treatment that they deserve. So I think adding that context to explain why it's important to take care of data, or why its data is hard, right? And why we need the stewardship and why we need that sponsorship. I think those are some of the techniques that I've used.
That's wonderful. And to hear you say that you're able to put yourself in their shoes and see something like data governance, which can sometimes be more avoiding risk rather than creating, the next new capability. It can be hard to get people to sign up for that. So putting them putting yourself in your shoes and helping them to see it, helping them to understand the challenge, and what they'll be able to get out of it, I think is incredible. Thank you, Bhavna Mehta, for joining me today. And for anyone listening, please visit cdomagazine.tech for additional interviews.
Thank you, Mike. It's a pleasure.